Ladies and gentlemen, please welcome our esteemed guest, Professor Dr. Bernhard Hirt, sir, along with Honorable Founder Chairman, sir, Dr. Bernharo Hirt, sir, Honorable Vice Chancellor of Aurobindo University, Jyoti Tandon ma'am, Honorable Registrar of Aurobindo University, Dr. Anand Mishra, sir, Honorable Dean of Student Welfare, Aurobindo University, Dr. Jayashree Dapadia.
Switch on both your microphones.
Knowledge is silver, but true wisdom is gold. Knowledge is the eye of desire and can become the pilot of the soul. Good morning to everyone present here. Sri Aurobindo University finds immense pleasure in welcoming all of you. I, Mehek Kulkarni, am delighted to be the host of this event, which witnesses the presence of not only great doctors, but leaders of their respective fields. Today, we are honored to have amongst us our esteemed guest, Professor Dr. Bernhard Hirt, sir, along with senior officials, Sri Aurobindo University. Once again, I heartily welcome you. I would like to request our honorable guests and esteemed dignitaries to please light up the lamp and pray. and Director AirCat India, Dr. Mohit Bhandari, sir. I would like to request our honorable guests and esteemed dignitaries to please light up the lamp and pray to Goddess Saraswati to shower her blessings.
Tika first. Mohit. We need to do Tika. Birthday Ganesh ji ko. Chapel. And Saraswati. Now can we have the candle? Please come. You have to light these lamps. I'll just show you now. Yeah. Like this. Perfect. Mohit. Dean sir. Jai Shri. Anand.
Towards the light, and that makes them beautiful. They are a symbol of positivity, serenity, and purity. I request Dr. Mohit Bhandari, sir, to present the sapling to Professor Dr. Bernhard Hirt, sir. Thank you, sir. Perfection is not attainable, but if we chase perfection, we can catch excellence. Sri Aurobindo University is the place where curiosity meets conversation and where every interaction is a step towards enlightenment. I request Pro-Chancellor of Sri Aurobindo University and Director, AirCat India, Dr. Mohit Bhandari, sir, to please present the welcome address and introduce our esteemed guest.
Thank you very much, ladies and gentlemen, for gathering here in such a large numbers to welcome Professor Bernhard. And when I would introduce him to you, I would make sure that you feel very justified for me to have invited all of you in midst of your very busy schedule today. It's a Monday today, and this is the peak time in our outpatient clinics. I invited almost all the faculty members, but when I introduce you to everybody, it would look justified. So Professor Bernhard Hirt is basically a professor in anatomy at the Tübingen University. Apart from being one of the most prolific anatomists, he is also an ENT surgeon, an ENT specialist. But why he is here? What's the reason for him being here? There are very less number of individuals I have come across in the field of academics who would change the entire landscape on how medical education is being delivered to surgeons, physicians, postgraduates, and even medical students. I still remember when I was in my first years and I used to go to anatomy dissection hall. That was the worst of my times. I never enjoyed doing dissection. In fact, to learn the anatomy in greater details in that format during my first year of medical school, it was very uninteresting. And somehow I passed through because I could mug them all up. But when we reached our clinical sciences in our final year, I realized that there is a lot of clinical anatomy application into everything I was doing. I still remember there was a patient who came with ulnar nerve injury into our outpatient clinic when I was doing my casualty duties as a second year resident. And we were asked about the anatomy of the ulnar nerve. That time we realized we were just trying to mug that up while we were trying to pass our first years. But now the actual application of that anatomy came. So Professor Bernhard did not stop there when he started practicing as an anatomist, but he made sure that all of us sitting in this hall, they have his fantastic legacy to carry forward, where he made one of the most advanced surgical minimal access surgery training lab on fresh cadavers. Cadavers in our own institute and several others across the world are not of that great quality. And that's why when we try and go and study the anatomy, we never understand as to how we can apply it to our clinical knowledge, because every time when we see that cadaver, the anatomy looks a whole lot different when we go inside with a scope. Let's talk about the abdomen. I am a GI pediatric surgeon, so when I go into a cadaver anatomy which is not well prepared, and I look inside, and when I go back to my patient with a laparoscope, the two things are so different that it makes no sense for me to go inside the cadaver and look at that anatomy. But what Professor Bernhard has done is that he has devised a technique to keep these cadavers fresh, like a fresh live human body, for at least 3 to 4 years. It's his own patented technology of producing fresh cadavers. And you know, I always say that the best way to transfer something to the society is to leave a legacy. And what a legacy he has left. He has devised a way to keep these cadavers fresh, so even when somebody is dead, he is transferring goodness to the society. And these cadavers are like the real human body, almost real. You cannot say that it's impractical to say, because sometimes there is a lot of time which passes off between somebody's disease to when he treats them. But what he did, he devised his own technology, his own molecule, which he patented, and now he is ready to share his expertise with all of us here sitting in this hall with our Department of Anatomy. So all of us belonging to different specialities, it may be surgery or gastroenterology or ENT or ophthalmology or orthopedics or medicine, we can go inside and we will have a very neat and clean abdomen, good anatomy, preserved landmarks. That's what he's going to help us with. Not only that, if you are to visit that part of Germany, Tübingen, it's a small city, and he said that the population is 75,000. It's the population of people in this campus now. So if you were to visit, without asking him, I am extending you the invitation. Please go and visit his fantastic surgical lab. How an anatomist can change the way how we surgeons learn about anatomy, about surgery. That's what he has defined. I always say that it's easy to learn skills. Skill is something you can hone by practicing. But if you do not know where to go, if you are not having navigation, if you do not know the anatomy, there is no point. You will just be a craftsman. You will never become a clinician till the time you know the exact anatomy, what landmarks you are dissecting. I've seen surgeons that do such a beautiful surgery, but when you ask them where is the right venous, where is the left venous, they have absolutely no idea. And we are not here to teach the students or the postgraduates of the surgeon just how to do it, but why they are doing it, where they are doing it, and what would create lesser complications. So Professor Bernhard, thank you so much for taking your time out and also showing the willingness. Obviously with IRCAD India, we have a contract with IRCAD, so you will help us because of that relationship you have with IRCAD, but you have been so gracious and magnanimous to come here in the institute and share your knowledge with all of us. So I would want this lecture should be more inspiring and it can be informative, but it has to be more inspiring for all of us sitting here, because I have that personal thing inside me that whenever somebody joins paraclinical departments in India, they think it's a dead end. They are just now teaching in a medical school, and the innovations, I'm not talking about everybody, correct me if I'm wrong, I apologize, but I am seeing that innovation dies there when you choose a paraclinical branch here, especially in India. And what I want you is to inspire all of us that in every branch we choose, we have a lot to deliver to the society. We just need to innovate, we need to think out of the box, and we need to believe in our dreams. So the stage is all yours. Thank you very much.
Thank you, sir. Leadership is not just about a title or designation. It is about the impact, the influence, and inspiration. I request Professor Dr. Bernhard Hirt, sir, to kindly address the keen audience with his knowledge and expertise. So, please.
So, thank you for this very kind words, and I would like to say hello to everybody. It's definitely, I'm deeply touched. This is for sure, and very, very impressed what I have seen. So you have heard something about my institute and what we did. However, there are of course several institutes dealing with training, and I just try to start in parallel my talk. Okay, like that. Okay. Should come. Yeah, it is. Thank you very much. So, of course, things are changing right now, and this is a good thing that worldwide people think about education, think about have visions. And what I can tell is what I have seen here. It's not just vision. I realize that in your institution you do it, and this is something really completely different, not just claiming to do something, but also taking really very focused ideas and strategies how to do it. And I'm very clear and sure about it, that you will be one of the most important places for surgical training in India and also worldwide. This is pretty clear when I see what's going on here at your place. So thank you very much again for this invitation and for everything. Well, innovative surgical training is the topic. It should deal something about innovation. I would like to start with the summary, to be honest, and show you how it looks like with different aspects in our facility. So I start with the movie, and it should be somehow with music. I don't know. It does not work. I have to sing. No, it's okay. And there's music like in a spa or something behind. But this is how it looks like in our dissection hall. So we have a training center where we host 2,500 surgeons per year, coming from every surgical discipline, doing every surgical approach from arthroscopy, laparoscopy, and so on. And what you can see is that we have different concepts in teaching, different types of lecture halls. Of course, there's always the need to go for catering, socialization, and things like that. This, I always have the feeling, is the most important issue to let people discuss about what they learn and see. This has been the dissection course. We have 500 medical students per year. And by using modern digital techniques with the green screen studio, we also enable anatomist surgeons to enter virtually the dissection or the lecture. So this helps a lot for multiplying everything. We usually have a lot of different universities, people coming from other collaborating institutions, to bring together knowledge. So, as Dr. Morbid told you, aminolipin is the fixative we invented, and IRCAD France, you could see Dr. Antonello Forcione, the CEO of IRCAD in France, is using this, and this is how it looks like. The retroperitoneum laparoscopically, so you easily can enter the areas or you can do neurosurgical approaches. You see the removal of the temporal muscle or heart valve implantation. Here you see the transsternal incision, sternotomy, and or the joint. So this is done by orthopedic surgeons. So the lung, and what you easily can identify is that the haptics are very different with our fixation technique, because it's very close to reality. It's not like rigid like in the formaldehyde fixed specimen. This is why we also can go for lymphadenectomy, neck dissection. Here you see the carotid artery, or to musculoskeletal surgical approaches where you go for different types of approaches. So what is quite special in our facility, and this also will be a topic of this talk, is that we started to organize a broadcasting system. And we can bring, this is what you see here, the anatomist in the live surgery. And this helps a lot if a colleague is discussing by entering the surgical field, the surgical approach. And why did we do this in the field of anatomy? I mean, usually this is the topic of surgeons. And of course, they are the people, the person that apply our infrastructure, and they use our cadavers. So the reason for why we did it in the field of anatomy is that we work and think multidisciplinary. So we do not just stick on a very specific discipline and deal with the upper GI tract and being the absolute expert on that. So we are dealing with basic knowledge, but on every part of the body. And this is ideal if you want to bring together different disciplines. And also if you want to do research and development. And I spoke to the Department of Anatomy here, and they are very, very experts in that field. They act in completely the same way like we do. They have the same educational concepts, the same concepts in going for fixation techniques. Well, the only difference is that we now have a different fixative, a chemical solution we invented, and we work on since 10 years now. And we were forced to do that because the German authorities and also the European authorities are very, very strict with biocides. Using biocides and fixatives, so preservation chemicals are biocides, and they most likely cause cancer, like formaldehyde does, or other aldehyde does, or Thiel's fixation, or saturated salt solutions, and so on. So they are forbidden in Europe, in all European countries right now. However, in some institutions they still use it, and why is that? Well, there is nothing else right now. We use formaldehyde as a fixative in the field of anatomy since 120 years. And this is a field without any innovation, obviously, because there was for 120 years no change in chemicals, no change in the usage of preserving bodies. I love formaldehyde because it's working perfectly. So the digestion does not occur anymore. However, tissue is very, very rigid, and you cannot use it in most of the surgical approaches. This is the bad thing behind. However, if you want to teach students, this helps. If you want to go for surgical training, it's a problem. I now would very, very briefly give you some impressions or show you something about where we are located. What you can see here is, it's called University of Tübingen. It is located in the southwest of Germany. I just go back. This is the area where all the medical engineering companies like Karl Storz company, endoscopy, Escula, Erbe, KLS Martin, all the big companies come from our area. So there are a lot of inventors. Also Mercedes-Benz is located there, Porsche is located there. So it's a quite rich area. The richest area within Germany is the southwest. So Tübingen by itself is a tiny little village. 75,000 to 90,000 inhabitants, and this makes it somehow interesting. It's like as big as your campus almost, and but there are people from 130 countries. It's a lovely medieval village, small streets, and a lot of young people are there. And it was founded in 1477. So it's really one of the most prodigious and oldest universities in Germany, actually. So we have 30,000 students, 90,000 inhabitants. Every third person is a student. That means it's very young, open-minded, and international. We had 11 Nobel laureates there, and so on. I do not want to bore you, but some things might be interesting. For instance, Alois Alzheimer, you know, the Alzheimer disease. He was in Tübingen when he described this disease. Friedrich Nietzsche, you can see him in the lower row. He was the first describer of the RNA in DNA. So this is a very prominent place. It was the kitchen of the castle. In the mid-90s, he described that there is something in the nuclei of the cell which he called nucleic acid. So, what will I speak about now if we deal about surgical training centers? First, how to perform, and then if you perform in a good way, how to multiply this performance. This is something I, in my facility, always was looking for, not just to stay regional, but to try to get over the borders, to be international. And so I briefly come to the institute, some pictures you have seen. We got the certificate of Germany to be one of the 100 most important institutions in Germany, and this is just because of our concept where we do research and development and surgical training and usability testing for surgeons. So, the concept behind, the very central element, and this is the same in your facility, in your institution, the very central element is the donation program. You need to have very well-organized donation program with a high quality of cadavers. Then you can go for surgical courses. And of course you always have to think about the medical engineering company to help to bring them to your institution, because they will help with infrastructure. They are the people to bring the opinion leader, the international key opinion leaders. And they are the people who always try to bring the most recent knowledge and technology to your institution. So then, of course, the whole field of histology, molecular biology, and so on, tissue biology also is done in our institute. So, speaking about the donation program, the donation program is the heart of every surgical training center dealing with human bodies. You know, in Europe, there are some training centers like the IRCAD in France that started with work on animals. And we all know that IRCAD France is the most prestigious institute for training in the world. This is why you are part of this family, And this is why you will, and you are also one of the most prestigious institutes in the world. Everybody knows that there is indoor science and that you are part of it. So, dealing with animal models, of course, is helpful because you have the circulation. However, anatomy differs tremendously, of course. It looks somehow different. It's problematic in many cases where you want to teach for approaches to use animals. And in Europe, at least, using animals is very problematic because the society does not like it very much. So there are a lot of protests, and it's increasing right now. So it's way easier and better to use human bodies because this is obviously in a high acceptance of society. After death, if there was an informed consent. Informed consent is the recommendation of the International Association of, or the International Society of Anatomical Associations. There is an ethic committee, and they claim there needs to be consent, and the people who sign during lifetime that they want to donate themselves, they should be informed. So this is what we do. This is what you also do. And so this is just the perfect situation in law, in accordance with the ethical restrictions or recommendations given internationally. So in our case, you see the left thing here. This is the brochure that gives the information. And here in this descriptions, and this was done by with the okay of the ethical commission. So with this descriptions, our donors can decide whether they want to donate themselves for students' education, for surgical training, or for research and development. So the numbers we have, you can see it here. We have 4,600 people who donated themselves. This is the list we have. And we have 2,600 donors for research and development. And by having this, by investing in the best model systems, we were able to host 2,500 surgeons per year internationally. We have our 500 medical students per year and have contracts with 80 medical engineering companies. And this is what helps. And by this broadcasting situation we have, multiplication, we now have 50,000 clinician students and engineers registered for surgical live transmissions. So I can show you something about that. But having a donation program is not enough. You need this fixative. You need something to preserve, to increase the quality. And what you can see is we use formaldehyde still for students' education, where everything is very rigid. This is how it looks like. And if you go for aminolipid fixation, you can see if you take the lung here, this is the heart, stomach, so we remove the anterior wall, then you easily can see that it is from haptics very, very realistic. So, our lead substance, this is how it looks like, aminolipid. It is bactericidal, virucidal, fungicidal. So this is most important, and we have all the testings done by certificated labs. We are not allowed to do it by ourselves, by the approval committee of the European government. So they did it for us. We had to give it to them. So they figured out there's no bacteria anymore, also mucobacterial, so cadavers are free of tuberculosis, free of enveloped viruses like HIV, like hepatitis, like SARS-CoV-2, and also norovirus, adenoviruses, and so on. So, and a big advantage in the field of anatomy is that it's fungicidal. So we do not have mold, we do not have fungi anymore. And if we think about that, what happens here? What happens is that the fungi, they do not just act as organisms by themselves, they have enzymes. And the enzymes help to enter the cells and the tissue. The same is true for most of the bacteria. So if you remove just the bacteria or the fungi with some biocides, then the enzymes are still active. So let me tell you how aminolipin works. Aminolipin is a substance which does not create an aggressive chemical coupling between proteins, for instance, but it changes the three-dimensional shape of the proteins. And we visualize this in a dose-dependent manner with CD spectrometry and a very objective method, NMR spectrometry. So by using that, we could see that the proteins change their three-dimensional shape. And by doing so, the functional proteins like enzymes do not work anymore. So it's not a coupling between the proteins, it's an inhibition of the enzymes. And by having that, and also a denaturation, a changing of the structure of the structural proteins. And by having this, we have a bifunctional situation. We remove bacteria, but we also remove the enzymes of bacteria and fungi, and also the endogenous enzymes. And this is something we checked by thread analysis, where we used fluorescent markers and could visualize in a dose-dependent manner which enzymes in what concentration get inhibited by our substance. So on the positive side, we have the certificate not to be gene toxic, to be not mutagenic. It is non-volatile, it does not go in the air, and it will be officially approved by the strict rules of the European and German government. So it's just not cancerogenic then. And this is the difference to all the other ingredients. And the positive side effect, the body stays, from the haptical point of view, very, very close to reality. And this just should show you the mode of action, how effective it is. If you cook an egg, you see the white of the egg and the yellow. And if you put the white of the egg in a Ringer's solution, salt balanced solution, and if you then add aminolipin, you can see that you can cook an egg without heat. So this is how it shows that it's just very, very effective. And so we can use, and this is the second point, which is most important, we now can use our cadavers not once or twice if we use it in a fresh frozen state, but we can use them 20 times, 30 times. We, in our institutions, use them for 2 years, because then we have a big celebration with the relatives and the medical students. They organize everything. They cook, they bake some things, bakeries and so on. And this is why we also love it very much. And it is a very, very important endpoint of everything for the relatives and also for the medical students and for the anatomists. And there's no smell, by the way. This is also something which is important. So, if you have done this, and I'm sure that you will be able to organize it, because the anatomy department just is excellent on the best niveau internationally. So if you do this, and you just have to figure out if the climate here deals somehow different, then you will be able to go for research and development, to invite medical engineering companies, to invite different surgeons. And if they are here, if they come for training courses, if they come for research and development, then you will be one of the most renowned anatomical institutions. However, the next question is it possible then to multiply? And I just would like to show you what we did with this situation we have. So we did a wedding between the operating theater and the broadcasting studio. So we connected realistic surgical theater. This is in the dissection hall of our anatomical institute. And this is just, it's not from the hospital, but from the anatomical institute. And here you can see that we have all the different items you need for, this is a neurosurgeon, he did a spinal surgical procedure, and we were able to record it, to videotape it. As you can see, we have several camera settings, directors' places, and so on. And we also can go for video transmission. For instance, here, this is a lecture hall in the Emirates right now. So he's actually now director of the hospital in the Emirates there, and he's giving broadcasting in our institution to the Emirates, and this will go bilaterally. So the lecturer can ask questions, they can use tools for chats and for asking questions, a text system, and so on. And then we implemented and connected everything to a green screen studio. And by having this green screen studio, we have the chance, what you can see here, that an anatomist is acting at the green screen studio, and we virtually can bring him or her into the surgical field. So he can describe, he just looks to a monitor and can describe what he sees while the surgeon is doing live surgery. And this is loved by our students, and this is why we have 15,000 students, all universities in Germany applied for. And when we go for live surgery, sorry, I always have to skip it, there's an automated function, I don't know how to stop it. By having this, we had 30 lecture halls connected, where students from all universities observe when we do surgery, and this is a minolipin fixed specimen. So, and now we come to the situation that I can show you how we do a marketing for that. And this is actually the next movie you will see, is the how we tell the students, well, you have a lecture. And this is just, we have, because we have this media team in our facility. This is how it looks like. There's a tremendous music actually behind, and here you can see that it works like in a television, more or less. So you can see that the anatomist can enter the places. This is a live dissection where people discuss. We have chat rooms they use, we have a TED system added, we have a second stream we can use, and we also invite, these were anatomists from other universities, to invite people to join us. So, finally, I would like to ask the last question. How is it possible to address medical engineering companies? This is important, and I have the feeling that you will do best with the people in charge here. I spoke to Dr. Moabit and his vision and his ability to get in contact with them. He knows all of the big companies. And I'm pretty clear that if they see that you have model systems you can work with, that this is a center which is giving, well, multiplication to all over India, the possibility to that, they will come by itself. However, in Tübingen University, in our facility, we in addition organized a different platform. And this different platform we use is shown in the next video, and it's a very short one. We change the flow of education. Usually we learn from the medical engineering companies. However, the engineers and people in charge there, they do not have the chance to speak with the surgeons normally. So we changed everything, and we invited the engineers and participants of courses, and these courses are held in our institute in the realistic setting. We have 12 such operating places you could see, and by inviting them, they can just stay next to the surgeon and ask him questions. They also can hold the endoscope or the scissors, and this is very, very effective for them and very, very helpful. And this is the movie now, how we invite them. We call it Einschnitte, Einblicke, insights and section. This would be the translation. But of course, the music is missing. In this case, it again sounds like in a spa, in a wellness center somehow. But here you can see, this is the head of the plastic surgery. You can see a lot of medical engineers discussing with them. And then there are the surgeons to give live surgery, and the others can just come to the table and discuss. This is the CEO, was the CEO, one of the persons in charge of Karl Storz company. And then you will be able to have also Da Vinci robotic devices like we always have when we go for surgical training. So it's 1 p.m. now. So it's on the point to stop here. I really want to say thank you. I just was asked to give a vision how it might look like and will be, and again, I'm sure that your place will be one of the most renowned in India and part of the most important places worldwide then. I would like to say thank you very much, and I would like to come more often to this wonderful place. Thank you very much. If you have some questions, just ask. I did not emphasize the data set of fixation. We have tons of data, of course, we acquired. But I think this is not worth. It was more how we set up this training center, and to give this vision what might be true. You have some questions?
Just a comment that the section halls are so impressive. They almost look like an operation theater.
Yeah. But you know what? This is actually quite easy. I can tell you how I started with everything. We had an empty room where the medical students used to work. There was not a single instrument or a tower for endoscopy and things like that. So I started with training courses, and I invited the Karl Storz company to provide their towers. So they came every Monday with a truck, set in 8 towers or something like that, and we did 1 or 2 courses with them per week, and then on Friday they had to take it back home. So I called the president, the CEO of Karl Storz company, Mrs. Dr. Storz. I spoke to her and said, well, why don't you just leave your equipment over the weekend? This is way easier for you. You do not have to pay for the transport. And she said, well, it's a good idea. That's what I do. So I started working with Karl Storz company. But if we have Karl Storz, of course, Esculap company also wants to participate. So then it's quite easy. You go to Esculap company and tell, well, we have Karl Storz equipment all over the place. So they helped us with different settings and so on. And this is how it could work. If they see that they profit from, usually they go to the big meetings, medical engineering meetings. In Germany there's one, the Medica or the Asian in Dubai and so on, where they give the chance to people to come to the places. I always tell the CEOs of the medical engineering companies, well, if you go there, you have to pay a lot of money to get the chance for 2 days or 3 days to present your equipment. If you put it to this training place, you will have it all over the year. And the surgeons that wants to have it, they use it. And by using it on an ideal cadaver, on an ideal model system, it's so much more helpful. And usually this argument bites everything. And this is how we manage to organize everything. So we are not the best. Earcut is best.
I also saw the clip where you were injecting the solution, for example, in the neuro clip. Somebody was first removing the temporal muscle and then injecting, so that's how you need to do?
Yeah.
Various places inside the anatomy?
Yeah. So
cadaver?
what we usually do is we inject it, it's microformaldehyde. We use a trans, and this is what the anatomist here perfectly do on a regular basis. So what we do is we injected the fresh body through the arteries with the fixative solution.
Correct.
And then we, in our case, we store them at room temperature without any decay. So there won't be changes, a lot of change. Of course, temperature and dehydration might occur, so you have to pay attention. And this is something we have to figure out, of course, if it will work here under these circumstances. However, I'm quite positive that it will work. It will be better than Thiel's fixation, and it won't be cancerogenic. So, I mean, this is the most important argument, of course. And then you can go to remove the temporal muscle, and then you can do craniotomy, and then you can do neurosurgical approaches. So in our institute we have 3 neurosurgical courses per year, several times, but 3 different areas. One is the lateral suboccipital approach for acoustic schwannoma, and the second is an aneurysm course. We have a clipping course where we use the pterional approach, the neurosurgeons do, and so it's possible, and then the spinal courses and so on. You can use it on every discipline. So, thank you very, very much.
Thank you, sir, for the informative and enlightening presentation. Life is a mountain. Your goal is to find your path and not just to reach to the top. We are indeed fortunate to have the source of invaluable guidance on our side today, who shows us the path all the time. Our Honorable Vice Chancellor, Aurobindo University, Dr. Jyoti Bindu ma'am. I request ma'am to please elaborate about the process of elicitation and to share a few words of wisdom. Ma'am, please.
Good afternoon. Sri Aurobindo University is a leading educational institute of North India, and we take honor in felicitating the learned dignitaries who have made significant contributions to a particular field or to society as a whole. Recipients of this felicitation are distinguished figures in their respective fields, such as renowned scientists, artists, politicians, philanthropists, or leaders in various domains. This honor is typically bestowed upon individuals who have not only pursued formal academic degrees but have also demonstrated exceptional achievements and made substantial impacts in their areas of expertise. The significance of receiving this felicitation lies in the recognition of an individual's outstanding accomplishments and contributions. It serves as a way for institutions to honor and acknowledge the recipient's exceptional work, expertise, and influence. It can also help foster the connections and collaboration between the recipients and us, thus promoting mutual benefit and the exchange of knowledge. Friends, as we have seen in the last 45 minutes, Professor Bernhard Hirt is a well-known figure in the field of anatomy and medical innovation. He's working as Professor of Clinical Anatomy in University of Tübingen, Germany. He's already received his PhD, and his research probably includes invasive surgery and cranial vascular surgery vastly. But he is primarily recognized for his pioneering work in the field of clinical anatomy, especially in the cadaver preservation technique. He has definitely contributed to advancing techniques, technologies, and developments, and this expertise and innovation has helped improve the cadaver learning by medical professionals and revolutionize the anatomical practices. Given Professor Hirt's significant contributions to the field of anatomy and his leadership in medical innovation, he is being felicitated today by our university, which is an educational institute of fame, and such an honor would recognize his groundbreaking achievements, his dedication to advancing medical sciences, and the impact of his work on the medical community and medical education. So I would request our Pro-Chancellor, Dr. Mohit Bhandari, to join me in felicitating Professor Hirt, please.
Deeply touched. Thank you.
Thank you, sir. Thank you, ma'am. A thankful heart is not only the greatest virtue, but the parent of all other virtues. I request Dr. Anand Mishra, sir, Registrar Shri Aurobindo University, to kindly present the vote of thanks. Sir, please.
Namaskar, respected Professor Bernhard, our Pro-Chancellor Dr. Mohit Bhandari, our Honorable Vice Chancellor Dr. Binder, Dean Medical College, Dental College, and other institutes. We at Aurobindo University have a tradition of keeping ourselves always ready to learn and expose ourselves to the world. From our bottom of heart, we really want to express our gratitude to Dr. Bernhard for sparing his time and sharing his gained knowledge to us. We are witness of his energy, enthusiasm from last 3 days. Thank you very much, sir, for a fantastic sharing of knowledge and your word of wisdoms. I am very much thankful to our Pro-Chancellor, Dr. Mohit Bhandari, sir, who has made this possible, the visit of Dr. Bernhard to our institute. And I am sure with your vision, we will be keeping ourselves updated and will be ready to serve humanity at each and every time. Thank you, sir. I am very much thankful to our Honorable Vice Chancellor, Dr. Jyoti Vindal Madam, who has always shown us path and who is the pilot of this event. Thank you very much, Madam. I am very much thankful to all the heads of institutes, professors, teachers and students for sparing time and exchanging the knowledge with Professor Bernhard. Thanks a lot.
Thank you, sir. In the symphony of thoughts and discussions, each one of you was a vital note, contributing to the melody of this event. Thank you for being here today and sharing some value, time, and efforts for the precious event. Thank you.